Coming up, we'll be on location at One Alkaline Life LLC in Waldorf, Maryland, discussing the benefits of integrative mental health therapy and how it can effectively help improve your life, relationships, career, and improve your overall wellness with one of this region's top mental health experts, Sharita Sivels. Welcome, Sharita. It's a pleasure having you on our program.
Thanks for having me.
It's your first time, in fact, on with us. We have a lot to talk about. And I wanted to begin because you obviously are recognized in this region as one of the top mental health clinical experts in your practice, One Alkaline Life LLC, based here in Waldorf, Maryland, have been helping so many folks improve their mental health and their lives utilizing an integrative and holistic approach that you utilize at your practice. And I wanted to begin again by asking you if you can please tell us about your vision for your practice and your unique approach in helping your clients.
Yes, of course. So one of our unique approaches of how we help our clients is, of course, the holistic approach, which has to do with helping the client with their whole person within. So that has to do with their mental, their spirituality, religion too, for those who have one, helping them establish some sense of peace, along with we even help clients with diet and nutrition as well.
Oh, you utilize really a mind, body, spirit approach,
Yes.
Looking at you clients, as you just mentioned, as a whole.
Yes.
In other words, you help them find the root cause or causes of their issues, as opposed to a Band-Aid approach, if I may use that term.
No worries, yes, exactly.
And now there's been a steady increase in mental health issues, as we all are very well aware, and certainly the pandemic heightened a lot of the issues that a lot of us were already unfortunately dealing with. And we've seen this over the last few years increase dramatically, and I wanted to ask you, what are some of the most common mental health concerns or issues that you're seeing in your clients?
Yes, so of course during the pandemic, a lot of clients have started to have to sit with themselves. And as they have been having to sit with themselves due to working remotely from home or due to the fears of the pandemic, the main concerns that I have noticed of disorders that have been coming within clients have had to do with depression, anxiety, ADHD. Some clients even have now started to discover that they are even on the autism spectrum. Along with some clients are now even finding out that they may have some type of personality disorder, such as borderline personality disorder. So a lot of the clients that we see, we tend to help them to become more self-aware of what it is that they are feeling, how they have came to about learning about their condition, and what ways and paths they can take in order to become a better version of themselves.
Yes, indeed. And with your expertise and having a full service, comprehensive mental health and counseling practice as you do with One Alkaline Life LLC, you help obviously folks dealing with a wide range of issues that go far beyond the few more prevalent ones that you mentioned.
Definitely. Some other ones that we have noticed is along with addictions as well. I know right now there's been a big opiates pandemic as well that's been going on, that people have been overusing and abusing substances. So there are times too that we see clients with that type of disorder. One thing that we have realized is that substance abuse disorder tends to be what we call a secondary diagnosis, because the primary diagnosis tends to run a little bit more deeper, which usually has to do with some type of trauma.
I see. Now, what can cause these conditions to occur in general terms?
Yeah, so it can be anything. You know, one thing about life in general has to do with stress. We all have to learn ways how to manage stress, and how we manage stress matters. So even when we think about back to childhood, you know, when it comes to the grade systems and how we have to receive grades and have to do work at a specific pace, sometimes that can cause children to experience high levels of anxiety. And if they don't have the proper skills to handle those anxiety feelings and thoughts, then it can lead to a disorder of something, a sort of like generalized anxiety disorder.
I see.
And then even depression. Depression is something that usually has to be activated. Many people have some type of feelings of sadness. Emotions are normal. It's what makes us human. However, when we have those intensive feelings that is causing us to not be able to get out of bed, or causing us to not be able to attend school or go to work, that's when we know it's more invasive and it's something that we have to work on.
And what adverse effects can this have on a lot of our lives and families' lives as well?
Mental health disorders, when they are undiagnosed and untreated for a period of time, they affect our quality of life. So it's harder for us to reach a feeling of joy and happiness when we have these strong thoughts, negative thoughts,
Yes.
that are guiding us and telling us things that are not healthy.
Intrusive thoughts.
Yes, intrusive
right?
thoughts. Yes.
And that would fall more under OCD type of issues, I would think, as well.
Yes, along with anxiety and depression too.
Yes, yes.
Intrusive thoughts are just repetitive thoughts that are continually popping up in our mind, and it feels that we don't have much control over them.
They literally can start controlling us.
It does.
Which and then in turn affects our whole outlook on things, right? And
Yes.
affects all areas of our lives, or
Yes.
can affect in a big level, unfortunately, in a negative way.
Exactly, because our thoughts, they explain to us what our narrative is.
Yes.
They narrate our story, our life, and what is going on. And when we have a chance to seek therapy and seek help and work on ways to change and challenge those thoughts, then we can reach a higher, better quality of living. As well as I remember how you asked about how it affects families.
Yeah.
A lot of times what many of us don't realize is that when we have children and when we are dealing with these mental health disorders and we're not seeking help, we are unconsciously passing on those same feelings and those same patterns onto our children. So it's easy for our children to see us anxious, and we are becoming anxious with them, and then for them to grow up to become anxious.
That's a great point. You're absolutely right, because we're their dad or we're their mom, and our family members, and when they're little, we're their role models in many
Yes,
cases, and the impact of how we feel and what we say or what we do is being impacted onto them, and it can be along those lines, which would be a big negative, I would imagine.
Exactly. And usually that's where some of the terms that we hear, such as generational curses, come into play. It has to do with just patterns, unhealthy patterns being passed down from generations to generations.
Yes, indeed. And what is the evaluation process, Sharita, for diagnosing a client's specific condition or conditions from when they initially contact you?
Yes, so one thing that we highly use is called the DSM-5. The DSM-5 has other series in the past, but it has all the different diagnoses that helps all of us clinicians to be able to go through a checklist of different things of what that client is stating that they are experiencing, symptoms that they are saying that they're having, and then it helps us to give a proper diagnosis to them.
Yes.
So what I always say is have that DSM right there, right next to you. It really can help, even when a clinician is unsure, because sometimes, it's okay to be unsure of what exactly the client is going through, because every client is different, but having a proper diagnosis, you can diagnose them using the DSM. And then what I normally like to do is that after I see a client for, let's say, about 3 to 5 sessions, then I will re-diagnose them to reassess where they currently are. Because then I had a chance to hear more of their story and learn more about them.
Absolutely, that's certainly good to know. It's a very comprehensive initial evaluation.
Yes.
To find out exactly the right or appropriate plan to help that particular person, because as you said, no two people are alike. We may have the same issues overlapping, but we're all different inside as far as what makes us tick and
Exactly.
the best way to approach attacking and resolving those issues.
Very true.
Now, is there a type of person, Sharita, that can be more susceptible, for example, to developing some of these mental health conditions that you've spoken about?
The main precondition things that someone can go through that can have one of these diagnoses is trauma, specifically childhood trauma. And the reason behind that is because, like a lot of our great theorists, such as Freud, P&J, Erickson, have mentioned that when a child is growing up, how they grow up is how they develop. And their development has to do with how they trust and see and handle stress within the world. And when trauma happens to them, that then becomes construed. And they are now have a different altered way of seeing the world. And pretty much what it has to do with, usually before the age of 8, children have a great sense of innocence. You know, they can run, they can play, they're very creative.
That's right.
And what tends to happen is around 8 to 10, they tend to see the world differently. And how they perceive the world, especially if they experience some type of trauma, now they are altered. And now they are seeing it in a tainted way that can affect them for the rest of their life.
Yes, absolutely, Sharita. So accurately spoken and said by you. You're absolutely right. It starts again during childhood, and then it goes from there, depending on what we are experiencing.
Yes.
And what would you say are some of the most effective strategies, Sharita, or therapies that are available to help folks dealing with these and other issues?
One approach that we highly use is holistic. Holistic approach helps us to give a more integrative, where we integrate multiple skills to tailor things specifically to that client. And usually those skills consist of things such as CBT, also known as cognitive behavior therapy. That has to do with helping the client to change the way they think and process things, to see things differently. And then other things such as DBT, dialectical behavior therapy, that has to do with helping the client to see things differently, but adding a mindfulness piece to it. So that way the client can become more present with their here and now. As well as interpersonal therapy. That has to do with helping the client to see how they evolve within their relationships. What play do they have and what role they have in their relationships. And then for clients that do have families, you know, family functional therapy is really great to see what role does that client play along with other people in their family, because they are all part of their environment and their growth.
Yes, yes. So you have a number of tools in your toolbox, in other words, at your disposal that you have gained over years of continuing education and really honing in on different areas of expertise, utilizing your integrative, holistic approach in a customized manner, because everyone's different, to really help each of your clients achieve their goals.
Yes.
Now, what type of results can typically be expected from these different strategies and therapies at your disposal? And I want to put in the proper disclaimer, and I know everyone's different, as we've already said, and they also have to be willing to work with you. You work together in a partnership manner, right? Because you can take somebody right to where the water is if they're thirsty, but they have to be willing to take the next step to drink the water. In other words, they come to you, you help them with these various therapies and customized solutions, but they have to be also willing to work with you, I would imagine.
Definitely. One thing, as you was mentioning, the stage of change where that client comes in. You know, we have 5 stages of change. We have pre-contemplation, where a client is kind of, you know, apprehensive, not really into therapy per se. Then we have contemplation, where the client may be a little bit thinking about therapy, but they're still on the other end, kind of still overseeing. And then we have preparation. You know, that is a great phase where we get to meet clients, because when they're in the preparation phase, that means they're getting ready. And they just need to have the skills in order to continue that journey that they are seeking. And then we have action, where they are right there in the midst of it, and they're doing the work. We're meeting with clients on a weekly basis, bi-weekly basis, and they're doing their homework because they want to change.
They really want to change,
Yes.
yes.
And then the last phase is just maintenance. Having that particular client to maintain those skills and maintain the change that they want for themselves.
Yeah.
So in regards to the time frame, usually I would say that it can range between 6 to 12 weeks.
From them to start seeing results.
Yep, for them
Typically
to start seeing
speaking.
results.
Okay.
Now, of course, as you mentioned, some clients may need a little bit more time, and that's okay.
Yeah.
There's nothing wrong with that. The main important part is that they are growing and they are seeking and becoming the better part of themselves.
Yes, absolutely. And again, I know this next question certainly depends again on each particular client and the various therapy or therapies that you are going to be helping them work through that you have available at your disposal through your expertise. But generally speaking, how many sessions do you feel is typically necessary to help folks deal with more of these common bread and butter type of issues, like stress and reducing anxiety and coping with depression and some of these other issues?
Yes, so at One Alkaline Life, we actually have therapeutic packages that tailor each type of disorder to help a client based upon where they currently are. So one of the packages we have is like a stress management and stress relief, which that has to do with that particular client that may be going through some type of adjustment issues based upon changes in their life, or grieving over a past loved one. And those can range anywhere between 4 to 8 weeks of sessions that they need to have. And those sessions can be intensive, where they'll receive handouts, they'll receive different homework assignments, along with able to correspond with their therapist on a more personal level so that they can reach the goals that they really have for themselves. Now, when we come to some other type of disorders, such as anxiety and depression, those things may take a little bit longer, because what happened over time is that that particular disorder has shown face of itself. So we usually suggest anywhere between 8 to 12 weeks with those particular clients, so that they can be able to really grab some good skills and learn different ways to use those skills within their own environment and home, so that they can just have a better way of looking and foreseeing things. And then along with ADHD and autism, which are neurological disorders, we try to frame that particular time frame between 6 to 8 weeks.
Okay.
And during that time, they can learn how to take those same skills, use them and apply them to things such as work, such as school, so that they can have different ways that they can help to handle their distractions or their hyperactivity.
That's certainly good to know. Appreciate you going into those details for our viewers.
Definitely.
And I wanted to also ask you, Sharita, are the results, once you have helped your client resolve whatever issue or issues that they've been dealing with, and you reach that point with that particular client, are the results permanent, or could something trigger those same conditions or issues to resurface where they would have to come back to you? I know you offer maintenance as well, maintenance services.
That is a great question. Some clients do believe that, when they do come to therapy, they're automatically healed and they don't need any type of help anymore.
Yeah.
But what happens is we are able to give them the skills to handle and tackle the world. So usually, no, they don't always need actual therapy itself, where it's a regular weekly or bi-weekly sessions. But maintenance sessions are very common, which we may meet with a client on a monthly basis just to brush up on some skills, or help to remind them where they currently are, or even just to give them a good cheer on. Along with a lot of clients too, they just really need an ear.
Yes.
That's the great part about therapy, is having some time to just have somebody just listening to you and vent to, along with someone that is just a non-bias.
It adds more when we're hearing it from someone else, right?
Exactly.
Than a family member or a friend. It just carries more weight subconsciously in our minds, I would imagine. And so for folks that are at the risk of regression as they, after you have helped them initially, then that's where that comes in.
Yes.
As you just mentioned.
Yes, the
Your
sessions.
ear is always there for them, to
Of
help them
course.
along the way. Now, what other types of therapies do you offer at your practice, Sharita, beyond the ones that you've mentioned here? As we're literally down to the last couple of minutes of the interview.
Definitely. One Alkaline Life, we have some great therapists we have on board. We actually have a sex therapist
Oh, okay.
who works with couples and that's able to help to reignite those feelings and intimacy with couples. We have a family functional therapist that is able to meet with families and help to deal with different issues that they are having amongst each other. We also have a grief specialist, a therapist who helps different people with grief based upon suffering things from loved ones that have currently passed, along with, of course, right now with the seasonal depression that is coming about due to the holidays. Her caseload is doing really well because there are a lot of people who are really feeling down about that. We also have a DBT therapist who specializes in dialectical behavior therapy to help clients, and then amongst a lot of other great team members as well.
Yes, indeed. That's why we're so proud to have you on our program. Between you and your colleagues at your One Alkaline Life LLC practice in Southern Maryland, you guys are helping folks throughout the region. You offer virtual services, of course, so you can have people can be helped through your expertise, all at the convenience from their home or wherever they would like to be, right? When they're doing their sessions with you.
Exactly. Yes,
Yeah.
Our vision is just to help change the world one client at a time.
Yes, absolutely. So very well said. And you and your colleagues are certainly practicing that, helping a lot of folks in the community. And on that note, I'd like to thank you, Sharita, for joining us, being a guest in our program today. It was a pleasure having you on.
Thank you. Thanks for having me.